and welcome to another episode of Marvelous Medicine. I have great pleasure in welcoming my batchmate, Professor t.balasubramanian. He's the head of the Department of Cardiology at Government Medical College, Trichy. His MBBS from JIPMER, Pondicherry, and his MD General Medicine and DM Cardiology from Madras Medical College. Bala is an avid hockey and badminton player, and his hobbies include delivering Buddhist philosophy talks. In his own words, Bala is going to share his stories, some laughable, some provocative, and some of which will lead to some soul searching. Today's topic, as we all know, is about managing stress for doctors. Moderating the session will be Bala's friend, Dr. G. Govindraj. He is the managing director of Harshamitra Super Specialty Cancer Center and Research Institute, Trichy. Dr. Govindraj did his MBBS from Tanjavur Medical College and his MS General Surgery from Madras Medical College. Went on to do his MCH Surgical Oncology from Government Royapettah Hospital, Chennai, and received the University Gold Medal. The founder secretary of the Trichy Oncological Society. He is actively involved in social service and has received several awards for the same. He is the founder of Dhanabhagyam Ganesan Pun Memorial Trust for Cancer Patients. Dr. Govindraj has delivered several lectures in national conferences. Welcome, Dr. Govindraj, and thank you for accepting to moderate this session.
Thank you, madam. Thank you. Good evening.
Joining Dr. Govindraj will be Dr. Meenal Chauhan. She is a freelance anesthesiologist at Roorkee in Uttarakhand. Dr. Meenal did her MBBS from Kasturba Medical College, Manipal, and her DNB anesthesia from Dinanath Mangeshkar Hospital, Pune. Meenal is a proud army wife and moves from city to city, successfully adapting both her personal and professional life. She has presented papers in many conferences and has received the General Proficiency Award from the Indian Society of Anesthesiologists in 2019. Meenal used the pandemic to do several programs in several courses in mind programming and psychological first aid. She has been helping her family and friends and colleagues to cope with the stress caused by COVID-19. She has recently started a public awareness page on Facebook, which conducts sessions for disseminating medical information to the public every Sunday at 11 a.m. in Hindi. They soon plan to start having programs in other languages as well. Dr. Meenal is a cheerful, vivacious person and the life and soul of parties and a wonderful singer. So if we have some time in the end, perhaps we could ask Meenal to sing for us today. Over to you, Bala.
Thank you, Dr. Vidya. Am I audible? Can I go ahead?
Come a little closer to the mic.
Yeah, is it okay?
Yeah.
Yeah, is it okay? Okay, thank you, Dr. Vidya, for the kindest words of introduction. My dear friends, in my 3 decades of cardiology practice in government sector, I have learned, unlearned, relearned many things and happiness in life, which I like to share with you all this evening. Marvelous medicine is a marvelous way of connecting and educating the future surgeons of India. And it is a very noble initiative of Dr. Radhakrishna's support system with Dr. Vidya. The entire team of Marvelous Medicine team is a very, very noble initiative. My congratulations to all of you. Having said that, Marvelous Medicine digital initiative can also educate, empower, and entertain the doctors. So precisely the reason why I'm here, that I would like to make you doctors very happy. So my dear moderators and fellow doctors, a very, very good evening to all of you. Please be reassured that my presentation will be more of a humorous inspiration, sharing my stories and anecdotes over 3 decades of cardiology practice. Let me begin my presentation with a question to the audience. Do doctors die young? Yes or no? Can you participate in chat box? I can 30-second clock with the permission of Dr. Vidya. Yes or no? Do doctors die young? All of you can just throw your ideas, participate.
Please use the chat box to reply.
Yeah. Okay. Good many yes. Thank you for participation. Good many yes. Doctors are dying young. It is a truth and a fact because in 2017, the Kerala chapter of Indian Medical Association, in a study of 10,000 doctors over a 10-year period, released the average date of lifespan of a doctor from Kerala as 61.7 years. The national average is 67.9, and that of a Kerala average is 73.9, which means on the average, a doctor from Kerala, God's one country, dies 6 years earlier than his Indian counterpart and 13 years earlier than his Kerala counterpart. A shocking revelation, but very true. That shocking revelation, I must say, that doctors dying premature death. Even last year, in the first wave of COVID pandemic, India lost 770 doctors. In the second pandemic, we lost another 740 doctors, including 6 antenatal mothers, which is a painful reminder to tell us that we are so vulnerable in delivery of healthcare. So doctors are dying young. It is a paradox too. Why, with good access to healthcare and knowledge, we must be living longer and healthier life, but we are dying young. Why is that? It is because of the stress and strain associated with our profession. In the name of saving human lives, we expose ourselves to huge risk. So we are dying young. So if stress is causing or killing doctors, what is the magnitude of the problem? Way back in 2015, the IMA, in a survey of doctors, gives a report or observes that every third doctor who was surveyed admitted to some form of stress. And nearly 20 to 25% of doctors have admitted some form of drug abuse, alcoholism, and smoking. Would you ever imagine that the suicide rate is the highest among doctor population, considering all the white-collar jobs? It is true, not only in India, in all parts of the world. So doctors are dying young, and the cause of death is stress among doctors. So what is the cause of stress among us? It is professional related. 90% of the time it is related to our profession. 8% of the time it is non-professional related, maybe health related issues, monetary or family issues. But 90% of the time it is due to our profession. And what are the causes of stress in our profession? Number one is the fear of violence, fear of litigation, then doctor-patient relationship, very poor doctor-patient relationship, unhealthy work environment, professional jealousy, extended periods of work, long periods of work, poor monetary remuneration, and huge expectations from our patients. So these are the major source of stress in us. So let me narrate 2 case studies which will illustrate how multiple stressors act in tandem in our day-to-day practice. 2 case studies, 2 doctor couples. The first doctor couple is obstetrician and a cardiologist. And the second couple is pediatrician and an obstetrician. Obviously, the first couple is me and my wife, where we work in Trichy Medical College as professors. One Sunday morning, my wife promised me to prepare green coriander rice and fish fry. A very good combination. All of you, please try. But our happiness was short-lived when she gets a phone call from a duty assistant professor. Her face becomes small. I said, what happened? She tells me that last night in the duty, the assistant professor had one of the deliveries, very difficult deliveries, shoulder dystocia. She could not save the child, and she was surrounded by an angry mob of 20 people. So she has locked herself in a duty room for a Sunday to start with. So immediately I warned my wife to call the police, see to that the doctors are safe, and inform the resident medical officer and the dean. So she does that, then tells me that she has to go and meet the assistant professor. She has decided I have to go because I am the family driver. So we go there. 1 hour later, when she returns to the ward, her face was even smaller. I could see clearly depression on her face. I asked her what happened. She described the scene there. The police had arrived. The doctor is safe. But at the far end of the corner, we could see a 25-year-old male sobbing uncontrollably, the father of the dead child. You see, whenever we lose a patient, particularly antenatal mothers and young child, a part of the peace and happiness goes away. Behind the white coat, every one of us doctors have a heart too. So my wife was suffering from clear case of compassion fatigue. Now, kindness, compassion, empathy, a part and parcel of our lives. We wear it as a badge of honor. But when it becomes in excess, it affects you physically, mentally, and psychologically. And my wife was certainly suffering from compassion fatigue. See, I tried to cheer her up by saying, look, last night you had nearly 30 deliveries, 18 of them operated deliveries, 12 difficult deliveries. So you have saved 29 lives, 30th life you couldn't save despite your best efforts. I think you have to move on. But she was not impressed. You see, in obstetrical practice, we have fetal distress, maternal distress, obstetrician distress. But will you ever allow to become a family distress? No, no. So, but any case, my wife was suffering from compassion fatigue in one hand, and the other hand, fear of violence. You see, multiple stresses. So this is one case study. So this family is suffering from family stress. The second case study involving stress of different kind, obstetrician and a pediatrician. This happened about 15 years ago in my hospital, which was not upgraded medical college. So that time, there was a huge shortage of doctors. So this doctor couple, no, pediatrician and obstetrician, were doing continuous duty for 4 days. So fourth day, the pediatric husband was very frustrated. He has not seen his wife, not talked to his wife, pre-mobile days, you know. So he went to the resident medical officer, elderly lady, and complained, "What, madam? I have not seen my wife. No, I have no family wife. What is this, madam?" He said. So the resident medical officer, very cool old lady, said, "Look, doctor, in government service, there is no family for government doctors. Please raise, please go." So the pediatrician was more depressed. He thought things will become better for another 2 days. No, it did not become. So 6 days, the pediatrician obstetrician couple was not seeing each other. So 6th day, frustration became anger. 6th day, he barged into the RMO room and said, "Madam, what is this? 6 days I've been doing continuous duty. You know what I'm suffering from?" The RMO said, "What, doctor? What are you suffering from?" He said, "Madam, I am suffering from ASD." "Arey, doctor, the moment he said ASD, the resident medical officer, maternal instinct is there. No, he said, "Doctor, please sit, please sit. What is this? ASD, you have not operated yourself." Maternal affection was there. Pediatrician said, "Madam, this is a different kind of ASD." "Arey, what is this different kind of ASD? I have heard of osteum primum, osteum secundum ASD. What is this new ASD, doctor?" Pediatrician said, "Madam, this ASD is acute sexual desire." "Arey, doctor, what is saying? What is it?" "Yes, madam. For 6 days, I have not seen my wife. 6 days, I have been treating only children who are crying. And today, my little John is crying. Please help me, madam. Please help me, madam." So the RMO was very scared, embarrassed from head to foot, said, "Doctor, what do you want, doctor?" Then he said, "Madam, leave, madam." "How many days?" "1 day." Go, take 3 days," he said. Then he warned the pediatrician, "Doctor, when you return from your leave, ensure that your ASD is completely treated." "Is it understood?" "Yes, madam, is completely understood." So look at the doctor, pediatrician. You surgeons make a sacrifice of different kind. You sacrifice your food, time, sleep. Our pediatrician has made a sacrifice of different kind, supreme sacrifice, sexual sacrifice, I would call. I would call him as a soldier in white uniform. You see, our Indian soldiers guard our borders. A grateful nation decorates them with Paramavir Chakra, Mahavir Chakra, and so on. So it may be wrong to draw a parallel with our Indian soldiers, but then in a humorous way, I would recommend to the Ministry of Health that our pediatrician must be given some awards, a small award. May not be a Paramavir Chakra. We are not asking for Mahavir Chakra, but one small chakra I'm going to ask, and that is Kamavira Chakra for our pediatrician. So this couple is suffering from sexual stress. So these are the multiple stressors which affect us in our day-to-day profession. The second cause of stressors is unhealthy work environment. I speak for the government doctors. The working condition in our setup is very really appalling, I would say. Always overcrowded, understaffed, superior medical officers not interested in the welfare of the junior doctors, and extreme stress. For every wrongdoing, the middle level and junior doctors are held responsible and accountable. The stress is too much. And we work in an inferior work culture. What is the inferior work culture? I think in any government setup, you have 3 categories of workers. One, more work, same pay. The second category is less work, same pay. And the third category is no work, same pay. This is a culture we work in. So there is no problem with the third category which doesn't work. The first category is the one which suffers because their lifespan is reduced by the third category. That is the inferior work culture we all work in. So the third reason or stressors is poor doctor-patient relationship. You see, when my patient expect me to behave like a doctor. I expect my patient to behave like a patient. Fair enough, because doctor-patient relationship is built on trust and confidence. But unfortunately, we are not living in an ideal world. We are living in a real world. So we have different category of patient: good patient, bad patient, ugly patient, marvelous patient, and of late new addition, we have a Google patient also. So who is a good patient according to me? Any patient who listens to 50% of your advice and take 50% of the medication you prescribe, I would call him a very good patient. A bad patient is one who will come to you 7 years after his first consultation and demand that his end-stage kidney disease should be managed without dialysis or transplant. An ugly patient is one who will come to you, he will not tell his name, he will not tell his complaints, he will tell, my sister's grandson is a politician, my distant cousin is a police officer, my grandson is a doctor where in North Pole. What is he trying to say? He is trying to say that he's a VIP. Such VIP patients move around the hospital side, we have to be very smart. In spite of all these categories, we have another group, rare specific bad patients, marvelous patients also, who will be very thankful and grateful to you till the very last heartbeat of the life. They are there. Then we have a new addition called Google patients who will Google the diagnosis, Google their symptoms, and come to you and ask for Google treatment, for which I would advise you must demand Google payment from them. So such is the category of workers we live in. And the fourth cause is professional jealousy. So you probably in no other profession we have such an amount of jealousy, unlike medicine, because we doctors, junior doctors, senior doctors do not see eye to eye. We never consider each other as colleagues, or fraternity is never in the picture of medical profession because we treat each other as a fellow competitor. Now, medicine, the competitive environment starts even before you enter medical college. Where do the children come from before they enter medical college? They come from factories. Which factory? Kota in Rajasthan. So by the time they enter medical college, they are actually humanoids. So UG, PG, super specialty, job in a corporate hospitals, name, fame at the city level, state level, international level, the competition goes on and on till they carry to the grave also. Such is the level of competition for doctors. And professional jealousy and professional jostling is another peculiar attribute to our doctors. Professional jostling refers to making comment about another doctor's diagnosis, treatment strategies in front of another patient or a doctor, trying to name him and shame him. I think this is one of the very bad attributes. I don't know why we doctors practice all that, but not remembering that you'll be one of the victim again. So professional jostling is one other painful behavior of doctors which you have to shed on. And I still remember one of my senior colleagues in one of the association meetings came to the meeting and actually thundered. He said, see, in the entire animal kingdom, a cat will not eat a cat. A dog will not eat a dog. But a doctor will eat a doctor. So that is the height of the professional jealousy. What a prophetic words, but that is true also. So we have to accept that. And finally, the burnout syndrome. Burnout syndrome could be the cause and the effect of stress. It is common in all professions, but more so in medical profession. This burnout syndrome refers to a triad of emotional exhaustion, depersonalization, and a sense of poor accomplishments. Emotional exhaustion means the person doesn't react to positive emotions or negative emotions. Even if a pretty girl comes, no tachycardia, no palpitation, no sweating, no fasciculation also. So he is not able to react positive emotions. Negative emotion also, no, absolutely emotional deadwood. He's a denervated person. So then depersonalization refers to that person or the doctor who suffers doesn't treat human as human. He treats them as subhuman or inhuman. And that is the reason why many of the doctors who shout at patients use abusive language, inappropriate body language, and land up in trouble. There was one of my senior doctor, nice person, but a short-tempered man. So he was one day seeing OPD in my medical department. Our GH is always crowded, So we have to be very smart because we have to dispose 100 patients in 100 minutes with 100 paracetamol. That's what you should be. So one day he was sitting in the OPD, one patient came. I think all of you are very aware of snake bite, cat bite, dog bite. Are you aware about pig bite? Pig. There was one case. So this patient came and complained to the doctor. Doctor sir, in your panni kadichiruchu. So the doctor did not respond. The second time again said, Doctor sir, in your panni kadichiruchu. So this time he looked at him and said, you are writing paracetamol and responded, ஒரு பண்ணிய இன்னொரு பண்ணி கடிச்சா உண்டாகாது கவலைப்படாது மாத்திரை எடுத்துக்கோ. Which means if a four-legged pig bites a two-legged pig, nothing will happen. Go. So my friend, in a matter of few seconds, converted the patient into a four-legged pig. So that is the height of depersonalization. So these are some of the source of stress in our medical profession. So having seen that, how does stress kill us? How does stress harms us? What is the neurobiology of stress? Now, the number one enemy is cortisol. The other hormones attributed to stress are epinephrine, norepinephrine, and dopamine to a certain extent, but cortisol is the number one enemy. So whenever there is a stimulus for stress, the cortisol level in the blood shoots up. And there are two types of stress. One is eustress and another is distress. In eustress, whenever there is a stimulus for stress, cortisol level increases, but it is matched by some physical activity and you have a tangible goal. When the goal is achieved, the cortisol level comes down. So there is no ill effects. So which is actually good. This is eustress as a part of fight and flight mechanism, general adaptive mechanism, which our ancestors had because they had to survive in jungles. But in distress, which is actually a free-floating anxiety, there is stress, cortisol level is elevated, but is not matched by any physical activity. So the cortisol level remains elevated, and elevated cortisol level induces a cascade of changes in the neurohumoral system, which can harm almost all systems, starting from nervous system, circulatory system, and even induces precancerous changes. So that is how chronic cortisol level hit us. And then even acute stress can kill us. Now, stress-induced cardiomyopathy or Takotsubo cardiomyopathy is well-known entity in cardiologists, but here the culprit is not cortisol, but it is actually a flooding of epinephrine and norepinephrine. It is often said that the cortisol level of a surgeon before a difficult surgery is 50 times higher than a colonel in the battlefield. Then you can imagine the amount of stress a surgeon feels. So that is the level of stress we all facing. So how do we manage stress? Now, as I said, the first fear for doctors is fear of violence and fear of litigation. So the golden rule for the young doctors is consider every patient as a potential litigant. Every patient attender as an attacker. You may be thinking, Bala, you are exaggerating, maybe overreacting, but believe me, that violence in doctors, against doctors is on the rise. It is occurring in a pandemic proportion. On June 1 of this year, there was a postgraduate student from Tamil Nadu in Assam was beaten blue and black because he could not save the life of COVID-19 patient. Why should a young postgraduate, unarmed postgraduate, should be beaten blue and black? We should think. It is occurring in a pandemic proportion. You know, in the recent times, what is India's undeclared national hobby? Let us hit doctors. There is a cow in Gujarat not giving milk, let us hit doctors. There is no water in Rajasthan, let us hit doctors. There is one health minister's cow is having constipation in Uttar Pradesh, Gaumata, let us hit doctors. So it has become a national avocation to hit doctors. Now, doctors in India have become punching bags and sitting ducks, literally, I would say, but it is the truth. Now, the second is fear of litigation. Imagine when you are dragged to the court of law for a frivolous litigation, who is going to help you? Nobody is going to help you. Your lawyer will make a fortune out of your misfortune. The police officer will enjoy your pain. And the free press will have a field day. They will crucify you before you reach the gates of justice. And one man in the three-piece suit in the AC room will be screaming from his lungs, the nation wants to know, as if the nation doesn't have any other work to do. That is the state. At that time, you'll be the lonely person in a lonely planet. So who is going to save you? The only thing that is going to save you is a well-written case sheet according to the tenets of law. Communicate everything what is given the consent form. Communicating the document and documenting the communication is the only thing that can save your life, limb, name, and fame. So there was a study in Ahmedabad, Indian Institute of Management, Ahmedabad, did a study about the pattern of violence all over India. So what could be the reason? What could prevent it? They said the communication skills and interpersonal skills could be one clinical soft skill that can save the doctor in question. Imagine if you are surrounded by a 20 angry mob, your gold medal in surgery is going to help. No, never. It is your ability to convince the gang that every single effort has been made with sincerity to save the life of the patient. That is going to save you. So let me tell you that this communication, interpersonal soft skills were never taught to us, and we also never teach our younger generation, but this is considered as the skill of the 21st century. And these soft skills, particularly communication skills, can guarantee not only personal success and professional success. Let me give an example. One of my patient, retired inspector of police, last year he came to me. 6 months after bypass, he was doing well. So I did a treadmill for him, 4th stage of Bruce protocol. He was doing well. So I told him, look, inspector, you are quite good. You can do all physical activity, whatever you like. So listening to my advice, his wife was sitting there. He said, doctor sir, doctor sir. I said, what? Looking at her husband, he said, this fellow, this dirty fellow, is putting his hands on my shoulder, doctor. I said, what is your problem? Your husband putting hands on the shoulder means what? Doctor, please listen, doctor. This fellow is 60 years old, I'm 58 years old. Both of them are old enough to be grandparents. If he's putting on the hands on my shoulder, what do you think, doctor? Please think, doctor. That time my tube light was illuminating. Oh, I thought, poor inspector of police is asking, requesting for his biological needs, sex from his wife, which is a legitimate request to a legitimate person, which is a crime according to the wife. But I am a professional, so I have to give a professional advice. I said, look, ma, your husband is as strong as a bull, and it is your duty to give him biological needs. It's your duty. So listening to all my advice, strong as a bull and duty, the inspector, you know what he did? He did the unthinkable act. He slowly got up. You know what he did? He gave me one salute like this. One salute like this he gave me, which I'm sure he would not have given even to the Director General of Police in his entire police career. Because that salute was so powerful, it came straight from his heart, the salute of gratitude, I would say. Then he came close to me and said, he held my hands and said, Dr. Sir, 6 months ago, you saved my life. Today, you have given me a second life. Thank you, he said. Then I told him, look, Inspector, don't get emotional. You have a lot of homework to do. So don't be cheer up. That's what I told him. Then he was very happy. As he was leaving, he gave a thumb up sign like this, to which I said this. So that is the power of communication skill, and the story doesn't end there. You know what happened? After that, every week, I used to get one inspector of police referred by that inspector. And today, he has made me unofficial cardiologist of Tamil Nadu Police Battalion. That is the power of communication skill. So having seen this, what is the second way to de-stress your life? So cortisol is there. Why don't you neutralize or reduce the cortisol level? Let us start with lifestyle changes. About your work schedule. So your work cannot be 24/7 into 365 days. Remember that after all you are human, you must realize that you are not the hero and heroine of all the patients you treat. You are the only hero, heroine of your family. So you must realize that your life, your working schedule should be 8 to 4. Take emergencies once a week. Seniors, probably juniors may take different calls. And once a week, the Sunday should be a golden Sunday exclusively for your family. And never ever monetize your Sunday. Once in a month, spend quality time with your family, friends. Laughter, levity is going to decrease your cortisol, increase your vagal activity. You feel very happy. Once in a year, go to incredible India, different parts of the India, wettest places in India. Go to Cherrapunji, Mausinram. You come to South Karnataka, Agumbe, or you come to Kerala or Tamil Nadu, Valpare. Get your trousers wet. And I swear, next 365 days, you will enjoy your life. So you must define your work schedule like that. Then the third would be, how do you neutralize your cortisol levels? Have as much as of your happy hormones, happy neurotransmitters. There are 4 neurotransmitters: endorphins, serotonin, oxytocin, and dopamine. Have enough of them. Now, endorphins are released in the circulation whenever you walk, play, running, cycling, any physical activity you do, endorphins are released in the circulation, and you feel absolutely nice, and it increases your self-confidence, fortitude, and resilience. And you feel very happy also. They give you runner's high. You do physical activity, that pleasure, the pleasure playing sports and games equal to that of orgasm. Yes, orgasm. And that is called as coregasm. Now, coregasm is a well-known scientific entity, but needs a lot of studies. A pleasurable sensation you get whenever you do strenuous physical activity involving the core group of muscles, the abdominal muscles, and pelvic floor muscles. The Kegel exercise, which obstetricians prescribe to female patients, are well known entity, coregasms, the pleasurable sensation one gets without any sexual activity, independent of your sexual thoughts and fantasies. Enjoy it by playing sports and games, and it does give you orgasms. It often said that women enjoy it, men also do enjoy it. That is the reason why these fellows, when play games, they want to play again and again. So I would advise that at least 3 days in a week, you go play and you'll feel entirely nice. And believe me, you'll sleep like a baby. So that is about endorphins. Then you come to serotonin. Now, serotonin is the second neurotransmitter, is released in the circulation whenever you do anything good to any human being. Any human being, any sentient or sentient being is one of the important concept in Buddhist philosophy. It refers to humans, animals, and plants which have feelings. So whenever you do good things, sharing, giving, teaching, the joy of teaching, caring, it gives serotonin. I see the motto of learning general surgery is helping others to rise. A good motto, Radha. I congratulate you. So whenever you help people, share, giving, you get a source of serotonin. That is the reason why when people raise pet animals, they give happiness. Then when you involve in environmental activities, gardening, you recover water bodies, you also get good amount of serotonin. Then 2 other activities also can ensure a good amount of serotonin. One is meditation, other is social connectivity. Now, social connectivity refers to having good healthy relations with your family, friends. Here, I must tell you the famous study on happiness, the Harvard study, which is one of the longest study in the medical research. One of the longest study. This study was started in the year 1938. 730 children in the age group 10 to 11 years was enrolled from Boston suburbs. Now, these children were followed up every 2 years with clinical examination. If there is a requirement for a CT, it was done. For 75 years, the study still continues. At the end of 75 years, the third director of the study, Robert Waldinger, was presenting the TED Talk about in 2015. Please, all of you find time to watch this YouTube TED Talk by Robert Waldinger on the longest study of happiness. So at the end of 75 years, they made their observation and found that who were the happiest, healthiest people, octogenarians at 75 years of study? They said it was not the person who had the biggest bank balance or the person who reached the top of their career. Remember, there was one president of the US, I think it was JFK. They were not the happiest. The happiest person were the one who had happy, healthy relations with their family, friends, and communities. So that is the power of social connectivity. The third reason for serotonin is meditation. Now, meditation, there are different types of meditation, but which one I am familiar is Vipassana meditation, which is considered as a treasure of Buddhism, because 2,500 years ago, Lord Buddha, he himself practiced and advised his disciples. Now, Vipassana meditation is unique in the sense compared to other meditations where they concentrate on breathing and mind concentration. The Vipassana meditation, the practitioners advise the practitioners to follow simple precepts in Buddhism. For example, the 4 unmeasurables in Buddhism, Metta, Karuna, Mudita, Upeka, they are kindness, compassion, equanimity, and sympathetic joy. So when you do meditation and follow the principles of Buddhism, these 4 immeasurables, Metta, Mudita, Karuna, Upeka, it gives a profound changes in the mental and psychological well-being. It has been scientifically proved that when Buddhist monks are practicing Vipassana meditation, when they're subject to MRI scan, they could found structural changes in amygdala, hippocampus, and prefrontal cortex. So neuroplasticity has been well known in Tai Chi that occurs following Vipassana meditation. So Vipassana meditation, the proof lies in eating. So Tihar Jail in Delhi, where you have high security prisons, where you have prisoners facing death sentence, you can imagine the amount of stress they have. When Kiran Bedi was the DGP of prisons, he introduced, and 2 months after meditation technique Vipassana, they could see a profound changes in the psychological meditative behavior of the prisoners. So now there is a separate Vipassana research center in Tihar Jail. Now Vipassana has crossed shores. We have Vipassana centers all over the world. And today, high security prison in US Donaldson prison has a separate cell for Vipassana. So Vipassana is so engrossing and profound changes. So these are some of the ways to de-stress yourself, not to leave your healthy habit on food, good sleep, and good financial management. Doctors earn money, but they don't know how to keep the money. Please be careful on that. Now, before I wind up, let me describe one case study which will the success story and the cost of success. Let us name the character of the story as Dr. B, age 49 years. He comes from a very humble background from Tamil Nadu, from a village. Fortunate to have studied in a military school in Tamil Nadu, enters JIPA for MBBS, then enters Madras Medical College for MD and DM. At 29 years of age, he becomes the youngest cardiologist. After that, his rise is meteoric. So, cardiologist, good practice, married to a doctor, have children, and a car, good practice, good house. At 49 years of age, this man has peaked in his life. I envy this fellow. So this man is like a Cinderella story, but every story has got a Cinderella component and the Sindhubad component. What is the Sindhubad component? The Sindhubad component is when 49 years of age, this man was playing badminton. He was a good hockey player. So when he was playing badminton, he was developing some discomfort. So anyway, he went to this hospital and took on the ECG. When he saw the ECG, he had the first shock of life, typical acute myocardial infarction. First shock of his life at 49. The second shock was 1 week later when angio was done, triple vessel disease requiring bypass surgery, second shock of life. The third shock of his life was a very, very stormy post-op period, 3 shocks of life. Fortunately, he recovers. 3 months later, he joins work, does all cardiology-related work. 1 year down the lane, he plays badminton. Today, in August 19, 2021, he is sharing a dais with you, sharing his personal stories. And that is me, Dr. Bala, my dear friends. So, in all humbleness, when I look back the journey of my life, I consider it as an extraordinary success story in all humbleness and humility. But then one question that kept in my brain again and again was, why me? Non-diabetic, non-smoker, non-alcoholic, normal lipid level, negative family history, with all the negatives on the left side. On the right side, very God-fearing, very ethical practice, living all virtues from a holy book, living a holy life like a holy cow, holy bull. So why should a holy bull get a heart attack? What to do? The only thing, the reason I could decipher was stress of what? In pursuit of academic excellence, I have been trying to chase gold medals after gold medals. And in the process, I almost lost my life medal. That was my fault. Now, if you define a type A personality as a person of rare character who works hard with definite aim and purpose in life to achieve success in anything in the shortest possible time, is type A personality. And why I was A into A square personality, that was my fault. So having suffered highs and lows, how did I recover myself? How did I rejuvenate myself? 2 medical doctors saved my life. One, Dr. Ravi Kumar, cardiologist, my batchmate, and second, Dr. Balakrishnan, cardiothoracic surgeon. Both were from Jupar. So I was very fortunate, very lucky to be on the safest hands on earth. And Dr. Radha and Vidya used to visit me in the post-op period. So Radha used to think in the post-op period, look at this fellow once ruled the playgrounds of Jupiter like an emperor. Today, this fellow is having all tubes. What to do? We have to face it. No. At 29, you can become the youngest cardiologist. At 49, you can have the acute MI, first victim. So the cost of success is acute MI. In type A personality, you are driven to goals, aims, perfectionist. But the end of success, you have a heart attack. That is type A personality. You have to accept it. So, having said all that, how did I rejuvenate myself? I rejuvenated with one social doctor. Two medical doctors saved me. One social doctor helped me in my rejuvenation. That is Lord Buddha, the first and foremost human social doctor of humankind. So, how did I learn about Buddha? So, when I was recovering my surgery, I didn't have anything to do. So somebody said, why don't you try Vipassana? So I started reading about Vipassana. I found it very, very interesting. They said, do this Vipassana. So you follow the principles or precepts of Buddhism, all these four immeasurables, five paramatas in Buddhism. What did they say finally? Buddhism is finally a moral progress, independent of God. It is a moral compass for you. In nature, a righteous way of living. And what do you get? The purest form of happiness comes from simple living. And I feel very happy today. And I feel I'm rich. Why? Because my needs and wants, necessities are smaller than my income. So I feel very, very rich and content. So, my dear friends, you have two choices before you. One, if you want to be the extraordinary cardiologist, neurologist, or a transplant surgeon at the national, international level, you can only be an ordinary parent, less than ordinary husband. But if you want to be extraordinary parent, a great loving husband, you can only be an ordinary cardiologist, ordinary transplant. So the choice is yours between former and the later. But some of you may ask me, Dr. Bala, between the two extremes of ordinary and extraordinary, can you be a good husband, good parent, and a good doctor? Yes, it is possible. The younger generation must learn from the errors for elder generations like me. I want you to learn from my mistakes. So you must be smart on your feet. So, my dear friends, before I wind up, the carry home message is we doctors in the practice of a noble profession must realize that we are neither God nor devil, but ordinary human in flesh and blood. And imperfections can occur in our profession. Our professional life should never be a race. Our family life should always come first. And every time, the greatest health you can all have is your good health, and contentment is a natural wealth. With these few words, let me thank the organizers, Radha and Nitya, for giving this wonderful opportunity. And let me wish a Buddhist wish by saying, Sukhi Hontu, which means, may you all be happy forever. Sukhi Hontu again. Thank you very much.
Thank you, Bala, for that wonderful talk. Over to you, Dr. Govindraj.
Yeah, good evening, everyone. Thank you, madam, for this opportunity to be a moderator in this session. That was an excellent speech delivered by Dr. Bala. It was a perfect blend of medicine, psychology, and philosophy. So I really enjoyed this session. And as we all know, being specialists in various fields, myself being an oncologist, we do preach our patients regarding stress. But unfortunately, we ourselves are victims of stress and we don't realize that. And this was a good session where we can take a little break, think over it, and rejuvenate ourselves. So that was an excellent delivery, Dr. Bala. Saying about balancing the professional life and the family life, it is really very important, because when you go extreme in the professional, then again you get a bad name in the family. On the other hand, if you sit useless at home also, then again you'll get stress at home. So it is necessary that we have to balance both. And during our work itself, you narrated a few incidences about your practice in the government hospital. I remembered one such incident when I was working in Madurai. I don't know, many of you might have experienced this in government setup. One of the patients, because that was a huge line, one of the patients was coming to the doctor, and he was complaining of hip pain. So this doctor asked where. So the patient immediately, he poked his finger on the doctor's hip. And then, so this happens in government. They'll come and touch our body and show this is where it pains, so that we understand better. Then that doctor, because naturally this will irritate everybody, but that doctor, what he did was, he said, luckily this fellow didn't have epididymoarthritis, otherwise I would have finished today. So, like this, we can make small funny narrations during our profession itself. That way we can balance both our professional excellence and our family life and our stress-free life. Thank you very much for the wonderful tips, Dr. Bala. It was an excellent session. Thank you.
Over to you, Dr. Meenal.
Hello. Thank you so much, Dr. Bala. I think you did so well. I was completely engrossed in whatever whatever you have told us. They were such pearls of wisdom from your own experiences. I have certain things to add, I think, here. When you spoke about compassion fatigue, yes, I think especially in the last 1.5 years, due to this pandemic, because of a lot of uncertainty, limited resources, poor role definitions, lack of skills of certain people, most of the doctors have suffered from something called as
Did we lose her?
Yes, I think so. So,
Ravi can pitch in meantime.
yeah. I don't know.
Sorry. Bala, that was fantastic. And like everybody has said in the chat box, it was a unique blend of personal. Oh, sorry. She's back.
Meenal, your internet was down. We couldn't hear the last a minute or so. Please unmute yourself. Your mic's muted.
Yes, sorry.
Yeah.
So I was saying that, there is something called as moral injury, which most of the doctors have faced, which is nothing but a psychological distress which we are all going through, because we are not able to help our patients the way we want to help, especially in the last 1.5 years, it has happened. It is violating our own moral ethics, basically. And most of us are suffering from that. We are helpless. There's a feeling of guilt. There's a feeling of disgust. There's a feeling of shame. Another observation which I want to make here is, sir, that I think because we are such learned people, there's a very thin line between, I think, confidence and arrogance, and which is where all the problem is stemming from. They say that the difference between confidence and arrogance is empathy. Empathy is listening to others. Empathy is being an active listener. Empathy is challenging stereotypes. It is normally said that there's a senior, you have to respect them. Respect is one-sided, but that doesn't mean that a junior should not be heard. And these are certain stereotypes which should be broken in our profession, even in government institutes. Even now, this is happening, that there is a hierarchy and you cannot speak in a particular way. You cannot express freely. You have to develop some empathy. And lastly, I would like to just add something here, which I have been practicing to remain sane, calm, and a few of the practices which helped me. I think there is something called as the happiness chakra. So every day, if you are able to think about an incident, a person who's giving you happiness, just by closing your eyes and visualizing everything around him, her, any incident, that will give you a lot of gratitude in life. That will help you to kind of pass away those feelings of, disgust, or feelings of irritation, feelings of confusion. Also, second is affirmations. If every day we get up and we just make one affirmation. Today, whole day, I will try and not get irritated. Or today, whole day, I will try my level best to not shout at anybody. Or today, I will not put anybody down. Or today, etc., etc. Meditation, of course, sir, you have spoken about it, so I'll not talk. And the last thing I would like to say is the grounding activities. Grounding activities, it just pulls you back from all those negative emotions, negative thoughts. And there are many ways of doing it. One way which I practice is by breathing. It's called as a boxed breathing. So boxed breathing is when for 4 seconds you kind of breathe in, and then 4 seconds you hold it, 4 seconds you breathe out, and 4 seconds you again hold it. And you keep doing this till that whole, that surge of emotions, which was kind of making you go all hairy, wary, and you wanted to respond and shout and scream, it will just pass away. It really, really helps. Gratitude, happiness chakra, affirmations, and some kind of grounding activities. So, sir, thank you so much. And yes, there is somebody in the text box has written pranayam. Pranayam helps. Of course, pranayam helps greatly. Everything from the Vedas helps. Everything from our Sanskriti helps in no way. Everybody is adopting it. It's just we who are not wanting to do it. We're wanting to go more foreign. But thank you, sir. Those were my observations. Thank you, ma'am.
Bala, your response to Govindraj and Meenal's observations. This issue about guilt fatigue during COVID, because we were not able to do the things the right way. What would you suggest to cope with that?
Did I understand correctly? Guilty of doctors not able to deliver appropriate health care. I think.
Yes, a moral injury when they are not able to deliver what they are supposed to because of lack of lot of constraints which they are having, especially in this pandemic.
Dr. Meenal, I agree with you, because most of the doctors, we felt that way, because particularly in our general hospitals, the first frontline workers were postgraduates. So sometimes they used to text us, sir, we are feeling very sorry, we couldn't save life. And this sort of a feeling, no, we are not able to save lives. I think there is, as you said, there is a thin line between empathy and beyond empathy. So you need to participate in the emotional component of the patient, but then you have to have a draw a line that should not affect your physical, mental health. So you must draw the line. You should be sensitive. Compassion, empathy are part and parcel of lives, but that should not cross a red line and affect you. And you will certainly suffer from compassion fatigue. That is can worsen you. Yes.
So you would say, sir, that here social interaction, family and friends play a very major role in pulling you back from all this, and sharing becomes very important.
Yes.
Woody, you were saying something. Go ahead.
Regarding, because I'm not able to hear what you.
Oh, sorry, Bala. This is Woody. I was just going to say that, like everybody else has said in the comment box, it was a fantastic blend of science, medical information, and personal anecdotes. So it was very nice. Thank you so much. The one thing that I do want to add is that actually two aspects. The first is for everybody, which is basically that you have to be very comfortable in your own skin to be able to carry out any sort of activity. And that becomes even more important for physicians, because not only are you doing your job, but there is also this societal concept that you're holding other people's lives in your hands. So that does require a certain kind of equanimity, which I wish would be taught in medical schools, and so that you actually get grounded yourself in that kind of responsibility. Society does place that on you, and you do have to do that. Part of it is to know that you're not alone, you're part of a team, and that everything that you do, the kudos that you get are not for you as an individual, but as a team. By the same token, the flip side, if there is a problem, it is something that the whole team has to share in and figure out how to work with it and how to proceed further. The second concept is, this whole thing of being perfect. Being perfect is really is not just boring, it's impossible. But the point that needs to be made is that when mistakes occur, the point is not about pointing fingers, but to understand why they occurred and take corrective and preventive actions that will prevent these from happening again. That's again a mindset, because the minute you say, you've made a mistake or something's gone wrong and it's a finger pointing exercise, there are all kinds of things, anger, guilt, everything comes in, which adds to all those stress hormones that you were talking about. So those are some other aspects that I was thinking about. Plus, for all of us, for instance, you, me, and everybody else from our batch, we're getting to the point where hopefully over the next several years, we will be thinking about retirement. So we need to not just plan for our financial future, but we also need to plan for our physical futures and everything else. So if we're not active, we need to get active. We cannot afford to, suffer too much from old age-induced sarcopenia. We cannot afford to start losing our minds. So we have to have some hobbies. We have to have some downtime where we learn how to manage our time. We need us time, whether we do it with meditation, whether we do it with listening to music or doing whatever it is that makes perfect sense to you. It makes a huge difference on how grounded you become. The more you take what you just said, which is we are just human beings and we have the same human being requirements like everybody else, I think that is a wonderful first step to start with.
Good evening, everyone. I'm allowed to interrupt. Can I, for a minute or two?
Yeah,
I'm Dr. Arjun, 81 batch. Hi, sir. Hi, sir. Radha, sir. Hi, sir. Is it the same Bala, the legendary hockey player of Jipmer?
Yes.
Very much same, Arjun.
Bala, sir. Good evening, sir.
Yeah, hi. Welcome,
Hi.
Arjun.
First of all, I would like to salute Bala, the legendary hockey player, because it's so timely that
Arjun, what keeps you happy?
Bronze.
What keeps you happy and going?
My game of tennis and my game of friends. If you call my phone, you can hear the ringtone. You can buzz my phone and then you see the ringtone. So my ringtone signifies to my people callers that my philosophy of life. But besides that, I want to pay my tributes to Bala, the legendary hockey player of our Jipmer, and also he's become such a wonderful physician and a cardiologist. Dr. Bala, sir, your talk has been so wonderful. You mixed dribbling, passes, and everything. Finally, you nailed the thing by hitting the goal, and you've been wonderful. So one thing from my point of view, my experience because I'm running a hospital for last 16 years or so, there are so many unanticipated errors that happen in medical practice, either surgical or even medical practice, physician practice. Despite all the precautions, the errors do happen. So it is very pertinent for us to be vigilant and watchful for this, how to prevent and how to learn from the mistakes. In fact, I have a presentation on this, and which I keep usually presenting in conferences. And one more regarding the empathy and all, as you say, the too much empathy again may point fingers at you that you're responsible. The needless suspicion goes to you. So that is one. And I feel more empathetic when a sudden unexpected event happens and it leads to very bad complications or a death of a child or a patient. Otherwise, if you've taken all care, you've done your best, and a patient has got multiple complications, multiple problems, you don't need to feel apologetic about your treatment, I feel so. And likewise, regarding documentation, nowadays we need to use the modern gadgets, a video counseling, somebody recording your counseling being done. Somebody should video record it, and also the CCTV in your chamber as well as in your anteroom of the OT also should help you, because finally we need to save ourselves, and we are in this profession to save people, not to kill people. You know the amount of the parent, the abuse that is happening to the patients verbally and physically. So how much our theory we talk, when you are in a crisis, at that moment, for the first golden hour of handling the crisis is very important. Just as in ICU, the golden hour of handling a crisis in a hospital setting more so than in a chamber. So whereas in a big hospital, I'm sure you have multi-layers of protection for you, but in a small nursing homes, because small nursing home account for 60% of Medicare, you are at the field, you are the buck stops with you, you are supposed to handle the crisis. So your presence of mind at that moment and effective communication, very effective and also targeted communication. Any slip of tongue will land you in trouble. Dr. Bala, I don't know if you agree with me.
Yeah, perfect.
Sir, once again, I would like to say, yeah, good to see you, sir.
Yeah, fine.
I used to admire your hockey skills a lot, sir, those days.
Okay, thank you, thank you.
Bala was the happiest when when India got the bronze this Olympics.
Yeah,
so, we've listened to most of the, for want of a better word, older people. I'd like to hear from Arunya, one of the youngsters who's logged in today. Arunya, please unmute yourself.
Dr. Radha and all, thank you. Giridhar, Bala, every one of you, thank you for the wonderful opportunity.
Bye.
I interrupted. Thank you, sir. I stay online.
Yeah.
Oh, Dhyanesh, is that you? You got
Yeah, that's me.
Okay, hi.
Arunya is my daughter's name. Yeah, it was amazing.
Dhyanesh has logged in from UK, and he's one of those. He was part of my team, and my teammates used to envy his, balanced home life. So, out with your tips, Dhyanesh.
Yeah, so I was relating a lot to the talk today. I've been here for about 6 months. And the stress for me is being in a new healthcare system where expectations are different on you. You have a new culture to live up to and all that. So I've been quite busy. I got a cycle. As soon as I came here, I've joined a gym, which has a swimming pool facility. So I'm keeping myself physically occupied. That definitely helps me because I'm staying alone, away from my family. The endorphins are definitely helping. Sorry. Yeah. Yeah, I'll definitely do that.
That's a good one.
Yeah.
Go with someone. Yeah.
Go ahead, Dhyanesh.
Yeah. So this talk was really useful for me, and thank you very much, Dr. Bala. It was a very nice talk, very apt for the current situation, especially with the pandemic in the background. Yeah, thank you.
So Ignatius, another cardiologist from our batch, is logged in for the first time in Marvelous Medicine. Welcome, Ignatius. Your comments on Bala's talk. Unmute yourself.
Hi, Bala. It was very nice hearing you talk. I remember our, days in the hockey field. It's very nice to see everybody. I really enjoyed the talk, and I almost endorse. I endorse everything that Bala said, and just was to re-emphasize what he said. One, have time for yourself, and in the hospital practice, I think make sure you document everything properly. I think at the present, the way that things are going, I think documentation, I think is the most important thing. And like Bala said, make sure you have time for yourself. Make sure you have, do a little bit of exercise, and if possible, play some sport. I know he plays badminton regularly. So thank you. And it was very nice. And, I really enjoyed and surprised to see Arjun and everybody else here, and Nim, and I saw Chaco there, Woody, and of course, my roommate, Radha, and you, Vidya. And very nice. Nice seeing you all. And God bless. Thank you.
Thanks for joining, Igni. We have another cardiologist, my colleague, Dr. Manohar. Dr. Manohar, would you like to say something? Okay, Chaco, since you have sort of interrupted your practice to join us, maybe you have to leave. So what would you like to say, Chaco? Please unmute yourself.
Now, before Chaco comes in, I want to know from him, is he continuing the same weightlifting and all that stuff and eating well and all that? Chaco, are you maintaining that?
Well, I must say I'm not all the way, but I am about 20 pounds less than what it was about 2 years ago. So I must be doing something right. I walk every day. I do some weights. I have a little mini farm, so I have some chicken. So I keep myself busy. I've been the happiest, over 20 years. I think the pandemic did me good, except for the income. but but I think it woke up. I've been doing certain things to mitigate my stress unknowingly. Even when I was an undergraduate, as you know, I used to exercise, I used to have some quiet time, sleep regularly, whether exam is bad or not, I didn't study or not, I just slept well. So all those things helps quite a bit. Also having some hobbies. I think it comes from internal strength. You got to have some strength. If your personality is such you're going to get nervous before a surgery, like Dr. Chari said, I cancel everything. We're not going to do any surgery because I don't like today. So if you're not too up to it, you don't have to do so many things. I start at 7 or 8. I stop by 2 o'clock. That's my cutoff. People have been fighting me all this 20 years. I said, this is it. 2 o'clock, I am mostly home or sipping some wine or doing something else. That's me. I sleep at 9 or 9:30. Nobody can, unless I'm on call. And by the way, the call, I think what he said is correct. You have to put your foot down. You should know yourself. If I can't do it, I just cancel it. I told the hospital, I can't do call anymore. COVID, whatnot. I'm 60 years old. I can't do all this. So I say no. Be ready to say no. I think we've been trained to. There's no other field where if you get 70 times over the net, you are a champion. In your field, you got to get 100%. How can you do that? I mean, that's too much of a, expectation. It's like a pilot. Well, I think the society's got too much of an expectation. We cannot always live up to it. And when we fail, I think we have to be kind to ourselves and our colleagues too. I have a small circle of friends I can share with my, occasional mistakes or what I think is a problem. So you got to share with, some people. You can't always share with everyone. You got to have a strategy. I spend a lot of quiet time reading. That's why I thought this might be interesting. So I do a lot of de-stressing by, social exercise, some silence, spirituality, maybe you can call it, some meditation. So yes, I think this is very important. This is, otherwise you kind of burn your candle on both ends. So it's very important that you at least thought about it now. So I'm happiest now as I've ever been, although the work is less and everything else. So I'll leave it to Vidya. Thank you.
Thanks, Chaco. Nalla, would you like to join in? Just unmute yourself.
Hello, hi everybody. Thanks, it was a lovely talk, Bala. I think that's the most appropriate topic which is of concern these days. Just to add a little bit of what we had way back in 1995, when I was leading the cardiothoracic anesthesia team with my cardiac surgeon and the cardiologist in Coimbatore Kobe Medical Center. Our chairman was quite worried because we had a string of patients dying, and then all of us were demoralized. So that time he organized a meeting with Sri Ravi Shankar, and then we had a personal meeting, and he came to our hospital, and in our auditorium, he conducted like even Meenal was telling about the breathing, the exercises and things to de-stress yourself. And he gave us a mini Kriya as well, which can be practiced in your OPD. So some of my cardiologists used to do it during the lunch break. You can take just 15 to 20 minutes, do the mini breathing exercise and take out your CO2, and that helped a lot. And we were quite, the cardiac surgeon was also quite happy. So what I was trying to say is that though we all are scientists and we all are more on scientific principles, whatever Sri Ravi did to us made a lot of difference, and the whole team of us were quite happy. So I think these sort of things should be inculcated in all our private practice people, because that's where the stress is more than the government job. That's what I think. But the private practice jobs are more stressful. So we do need to do certain other modifications and techniques to keep yourself free. Just thanks, Vijaya. That was lovely. Good presentation.
Dr. Anandi, would you like to say something? could unmute yourself.
Hello. Oh.
Yeah, we can hear you.
Hello, sir. That was a very excellent presentation, Sir Bala, sir. I belong to 1992 batch of GIPMAR. Happy to see many of our seniors here. Like I think doctors need to have other sort of diversions like music, games, and other things too, besides our profession.
Agree.
Yeah, that's a good takeaway. So another thing which Ravi Shankar mentioned in another session, and which Bala others also alluded to, we all have to learn to say no. Just so as doctors and especially as anesthetists, I think saying no becomes a big deal. So we all should learn to say no, and we should all learn to ask for help when we need, whether it's not necessarily only in the professional life, but in personal life as well. Like specifically, Ravi Shankar said that if your child is ill, you need to take off. You need to take off. There's no need to feel guilty or you try to burn the candle at both ends. So that's one other thing that we discussed in some other session of Marvelous Medicine, which I wanted to add. So, Dr. Govindraj, do you have any comments at this point?
Yeah, it was nice talk and nice opportunity. And Dr. Bala's connection to Buddhist principles was very excellent, because I also follow Buddhism. So that part was really impressive. And would like to know more about how Buddhism is related to doctors' lives. If there is another session closely for that, then that will be better. Thank you. Thank you.
Ma'am, there are two things I would like to just mention.
You need to be closer to the mic, Meenal. Your voice is a little low now.
Yeah. Yes, ma'am. Can you hear me?
Yeah.
Yeah. So there are two little things.
Yeah.
I think each person is very different, as as Patas sir just said right now. Everybody is very different, and we have to know our own strengths and play by it, because somebody's meat may be other man's poison. So it's really important to know and play by your strengths. So I think when you're eating, it's also important to eat calmly. That's very important. So if you take a few deep breaths before you start eating, that basically stimulates the parasympathetic system, and it really eases you. Another thing is, when just before sleeping, if you just breathe from the left nostril. The left nostril, you have the Ida and the Pingala nadis, which they say. So the left is basically supposed to calm you down before sleeping. We're always so charged up most of the times, the whole circadian rhythm is gone for a toss for the doctors. Most of us, at least, we are working at night and everything is happening like that. So I think before sleeping, if you just take some breaths from the left nostril, and then we have to make all this a part and parcel of our routine, slowly and steadily. As sir said, doing some breathing in between, grounding yourself, being peaceful, doing 5 minutes of meditation. I don't agree that anybody is so busy to not take care of the mental health, because right now mental health is more important or as important as physical health. We have gyms for physical health, we have nothing for mental health. Ultimately, we just end up in a burnout. So that's my little thing. Thank you, ma'am.
Chandra, pretty stressful to be a doctor, but it is even more stressful to be in medical management, I guess, because one side you have your if you're a company, you have your shareholders and your directors on one side, and the doctors on the other side, and you're kind of boxed in the middle. So what's your what are your
I had one point about the stress. I'm not sure if I missed out. As doctors, one important cause of stress, which even I face sometimes, is this hypochondriosis. Every time I have postprandial dyspepsia, I think of getting an endoscopy done to rule out CA stomach.
So sometimes doctors are usually bad patients. I thought most of them ignore their symptoms, but I guess a subset of us will be hypochondriacs.
Yes. Too much of knowledge.
That was third year. That was third year medical school for us. But yeah, I guess it will continue. So
Vidya,
Giri,
can I
sorry.
Sorry, Vidya, can I just add one thing to what you just said? This whole thing about saying no actually ties in with the other point that many people have made, and that is this whole concept that we have to be perfect. So, when the situations where we find it difficult to say no are those situations where in our mind would mar that perfect image by saying, oh, I cannot come into work today because my child is sick. I mean, how can the perfect individual do that? So this whole concept of that we have to be perfect and that we're not human, that we're, above a human being, that I think that's the root cause for a lot of these stressors. And busting that bubble, I think, is very important and has to happen right from the very beginning. Right from medical schools, etc. I wish Gitanjali was had logged in today, because those are the kind of things that people like her could introduce in medical schools that allow people to see that this is not something that you transplant on yourself when you're in your 40s or 50s, but you start from when you get into medical school, and it becomes a practice, an ingrained thing, like breathing out and breathing in kind of stuff. So it is basically this whole concept of you have to be perfect, and nothing short of perfection is acceptable. Just like Chaco just said, you have to hit it 100 times. 100%. That's the problem. And I think it's an impossibility.
Vidya, can I just say a small thing? Well, I just wanted to add on to something called as, what, the whole day when we work, our whole activity is in a flexion activity. This is something which I've been practicing for the last 6 months, which I wanted to share to all of you. When you go down to bed and just going to sleep, redo your flexion into a anti-flexion. That is, you don't external rotate, you internal rotate. There are some few exercises that you can do on the bed, exactly not flexion, but extension. What all you did in your whole day, most of the time you're sitting, you're working, you're folding, you're bending your neck. Just redo it as a repeat of the opposite, just for a few minutes when you just go to sleep. It makes a lot of relief in terms of your muscular relaxation. This is something that I want to say, because right from the birth, from the time you are in the womb till you're born until you work, you're always flexed. Yeah. But when you go to bed, just extend your whole part of your body. Just do the extension and external rotation. Don't go into, just do the opposite of what you're doing for the whole day in the morning. And it gives a lot of relief. This is something which I've been doing for the last 6 months, and I'll come out with those pictures and the yoga of this night. Just on the bed, just lie down on your bed, calm, with some music. If it's better if you can put on some Om music or some sort of a soothing music onto your headphones, which is very relaxing, and go on the external activity, thing of what you did for the whole day. So extend yourself, extend each part of your leg, your toes, your legs, your hands, then rotate them externally, extend your neck, extend your back, and go on your prone, just extend your neck again. Prone position always gives a lot of relief. Just for 10, 20 minutes of lying prone, extend your neck. Just do this for 30 minutes just before you go to sleep, just on the bed, nothing else. And it's made a lot of difference. I would like to know more if people can try this. Thank you.
Giri, your take on today's session. You'll have to unmute yourself, Giri.
It was a beautiful session, right from Bala to, and as he said, he's changed. He's got a second life. So coming to Meenal's and Nalla's inputs, I follow the SMS system, that is sleep, meditation. Sleep is very important. I think this was mentioned by Chaco also. Adequate sleep. Meditation doesn't mean just sitting still and meditating. You can do it anytime. As Meenal said, you just take few deep breaths before eating. That's also a type of meditation. And sadhana is any exercise which you do regularly. It could be a walk, 5 kilometers walk. It could be a gym. It could be swimming. It could be anything. So just continue doing that. SMS, sleep meditation sadhana. Which problem? Sleep one. Thank you.
Radha Krishna, over to you.
Vidya, I'm usually the last speaker. Does that mean that the session is getting over?
I don't
Anyway.
know. I don't see anyone else.
Yeah, to start with, Vidya, that lady on around your neck is very pretty. I don't know who she is.
She's Durga.
Durga. Oh my God. Anyway, see, some good things happened in my life, and one of them is joining JIPMER, and even better thing is having Bala as my roommate. Not to forget Digni. Bala is someone who's still my BFF, best friend forever. He walks the talk. He doesn't talk. He lived the way whatever is preached, and it's always soothing to listen to him. And at any time he calls me, he gives me advice about what to do, how to contact, or get in touch, and all that. Thank you, Bala, for all that. And it's a very, very mature and very, very valuable things you've spoken today, and that brought tears to my eyes. The happiness wise, Chaco spoke, Ravi spoke, and many others spoke. And actually, I think I'm still a happy man. I think Vidya should watch for it, because the thing I realized is that, especially in the private sector, the most of the time is spent is in the hospital, waking time, and you come back home to sleep. So I made myself very comfortable in my workplace, and that comfort comes from my friendly anesthetists, because I think surgeons should be very, very friendly to their anesthetists, and that's how the theater is a wonderful place, and that's what brought me and Vidya together. Even after working hours, we are, we collaborate, and this marvelous medicine is one such. She's brought life to LGS, I should say, by bringing in this. And I'm sure Vidya's life has also got changed, and she's got, she's become a celebrity, and her network is, beyond anything. See, it's nice to see Nala, because but for this medium, I wouldn't have heard so much of Nala or Ravi Shankar or Giri or whoever, and Bala, for instance. It's like that. And actually, my thing is, I got into digital media during this COVID times, and spent a lot of time and really enjoyed it. And finally it culminated in me and Vidya doing this thing together. And we have so many happy moments. We had interaction with some senior teachers. Some of them are no more, as a matter of fact. And that's very, very poignant. And we have a recording of all that. And I think I think I should mention this is my day starts when I, on my car traveling, I speak to Arul Selvi for at least 15-20 minutes in the morning and on the way back. And that is one of the most soothing things to do. I think you should have some, soulmates that way, where we can sort of, de-stress ourselves. And luckily, our JIPMER pattern is such that we have at least a friend or two in the neighborhood. One, I speak to her, and two is I'll get reprimands from Vidya every now and then that you're not made this poster, you're not done that, and that also sort of rejuvenates me a lot. If I don't see her message in half an hour's time, means something is not wrong, or something is not right, as a matter of fact. Wonderful, Bala, once again. I hope you'll come back many more times and say many nicer things. And your life story is a great example to how to get back to onto your feet, and make a good life of whatever is remaining. Back to you, Vidya.
Yeah, Vidya, one point. Vidya?
Yes, Bala.
Yeah. Vidya, one point, final message I like to give for doctors. There are 3 lives: professional life, family life, personal life. My take is enjoy all the 3 lives with one wife. That's it.
That's a difficult one, Vidya. I also, Ravi, I should tell you here now. A couple of us, Vidya, myself, Arul, we got into a bit of spirituality. Vidya hasn't got into it completely, but we are just getting into it. I think this is the stage, and we are really, really enjoying it. I'm sure you'll endorse that, Ravi.
Oh, absolutely. That's what I meant by doing things for yourself that sort of make you feel complete, and that sort of rejuvenates everything. I've been enjoying the discussions that we've been having. I've learned so much from that, and hopefully I've shared some of my input through my journey through all these things. And of course, like somebody said, music, physical activity, all of that is very important to do for yourself. And like Bala said, you have to integrate all those three lives. And the point is, those three lives should not be compartmentalized. You should be able to flow freely from one to another and take learnings from one life into the other and apply it right when it's happening. Because the more you compartmentalize, the more difficult it becomes. But if you allow them to flow very freely, it sort of enriches everything. That's my take on it. Because if you're into spiritualism in your personal life, bringing that or somehow letting it manifest in your professional life actually enriches the professional life. So I totally endorse everything that's been said. And, even without formally thinking about it, I think many of us are practicing a lot of these tenets that Bala, Chaco, Giri, everybody, Binal, every single person who's spoken, I think we've sort of unconsciously, subconsciously managed to do that, because otherwise we would not have survived to this point,
Well said. I think, Vidya, we should have one session on spirituality as well, the way we practice. Yeah.
So thank you, Bala, for offering to
It's Sadhguru.
Thank you, Bala, for offering to do this talk, and it was really wonderful. It was not like a lecture; it was just like as if we were having a conversation, sitting around with a cup of tea in our Jipma shacks. Like Dr. Govindraj said, you brought everything together. You brought science, you brought philosophy, you brought spirituality, everything into it. And thank you very much. And we hope that we'll be able to come up with another session with you in the future. Thank you, Dr. Govindraj and Dr. Meenal, for joining in and giving your inputs. And thank you all once again for joining in today. And yes.
Yeah, Giri.
Who is Dr. Giri's iPhone? I thought my iPhone was off. That's it. Dr. Giri's iPhone.
There must be another Giri.
There's somebody else.
Yeah.
Okay. Hi, Giri. Okay.
Hey, Bala, your hand is up. You want to say something?
No. I'm good.
It remained up.
Sorry.
Naveen is very much there. Yeah. Naveen, let Naveen say the last word.
Yeah.
You need to unmute yourself, Naveen. How did I miss you? Yeah.
Bala.
Yeah.
Thank you so much. It was so nice. Yeah. I didn't know how that 45 minutes just went through, no?
Okay.
It was so nice, and so God bless you. That was so nice, and yeah, we could hear your story and from your end, and it was so lucky to have guys like you in my life here.
Thank
I
you.
just remember, yeah, I just remember Bala as a so quiet guy. No
Exactly,
talking.
I was going to say that. Can you believe that the quietest guy in class is so erudite?
And he had the hockey stick do all the talking.
Thank you.
It was so good, Bala. Anyway.
Okay. Thank you.
Thanks, nice. Yeah.
Thank you all for joining, and we have more sessions planned coming over the weeks, and it's all mixed up, some scientific, some non-scientific, surgical, non-surgical, the work. So hope to see you all again next Thursday with yet another episode of Marvelous Medicine. Thank you once again for joining and for a wonderful interactive session. I don't think we've had such great interaction for any of the sessions in recent times. Thank you all once again, and good night.
Good night.
Thank you.
Good night. Bye-bye.